Hello, everyone. My name is Obaid Khan, and my research partner is Amber Pata Ellison. Our project is Alternative Measures for Improving Treatment Adherence for Tuberculosis. Tuberculosis remains a critical global public health challenge. Eradicating tuberculosis depends heavily on strict patient adherence to long pharmacological treatments. Because these regimens often last 6 months or more, medication non adherence is a frequent and dangerous issue. It directly leads to treatment failure, disease relapse, and the rise of multi-drug resistant strains. As nurses, addressing this non-adherence is a top clinical priority. Traditional medication-focused education is the current standard, but emerging research shows it is often not enough to sustain long-term adherence without additional psychosocial support. This led to our guiding PICO question: in patients diagnosed with tuberculosis, how do family education and empowerment interventions compared to traditional medication-only education affect treatment adherence and subsequent quality of life? To answer this, we conducted a structured literature search using CINAHL Ultimate and Cochrane Library and Google Scholar. We focused on peer-reviewed primary research published within the last 5 years that studied family education or self-empowerment interventions. By excluding systematic and literature reviews, we synthesized 6 high-quality studies. Across the studies, a clear theme emerged: health education that goes beyond traditional methods is absolutely vital. Specifically, educating the patient's family and support system makes a profound difference. When families are included in disease education, they better understand the treatment's timeline and complications. This builds a sense of empowerment that directly translates into improved patient adherence. We also found that social support extends beyond the immediate family. Fostering camaraderie with other patients and maintaining consistent relationships with medical professionals significantly boost patient motivation. Interestingly, general family education increases adherence even if the family isn't strictly supervising the daily medication intake. Overall, the literature strongly links these advanced education interventions with better coping skills, improved self-management, and decreased feelings of stigma. Applying these findings to nursing practice presents a major opportunity. Currently, direct observed therapy, or DOT, is the standard for ensuring adherence, but it is incredibly costly and time consuming. From a health equity perspective, shifting our focus towards family empowerment offers a much more accessible care option for vulnerable, low income populations who cannot sustain traditional direct observed therapy. By incorporating a patient's family into shared treatment decisions and training nurses in holistic education, we can bridge the adherence gap and ease the burden on public health systems. In conclusion, educating a patient's support system significantly improves medication adherence and overall mental health. However, a key question remains for future research. Does this increased adherence stem simply from moral support, or are educating family members effectively conducting their own direct observation therapy at home? Resolving this helps establish definitive clinical guidelines moving forward. Our references were formatted in APA 7th edition on the poster. Thank you for your time and attention today.